Okay, this is the study video for my final. What is external respiration? Alveolar level. O2 and CO2 exchanging according to gas concentrations. What is ventilation? Ventilation is the change in chest wall size and pressure gradient using the diaphragm. Air is going into the bronchial tree. That was ventilation. Okay, what's it called when oxygen and CO2 are exchanged at a cellular level? Internal respiration. Okay, Milwaukee scoliosis brace. How often a day can you remove it? 1 hour a day, just for hygiene. Will it cure scoliosis? No, it's just going to slow the progression of the spinal curvature. How do you wear it? Shit, that sucks. You wear it over your t-shirt. And there's no specific range of motion exercises for scoliosis. Okay, rupture of membrane. Think pregnancy. What do we have to watch out for? Think infection. What do we want to monitor? Infection? Temperature. Look at maternal temperature. Okay, artificial rupture of membrane, AROM. We want to monitor fetal heart rate before and after because we want to be able to detect cord compression or prolapse. Okay, in laboring clients, what do we monitor? Maternal blood pressure every 15 to 20 minutes. How annoying is that? Maternal temperature hourly post-ROM to detect amnionitis. Everybody gets looked at their white blood cells. And the fetal heart rate pre or post AROM, so that artificial rupturing. What is alpha fetoprotein? Damn, it's the sad one. You have to know the gestational age of the baby for it to be worth anything. But increased levels greater than 15 weeks could signify neural tube defects like spina bifida and ancephaly. Okay, if someone has urinary calculi, what are you going to be doing? Sifting for sediment, because healthcare is cheap and they want to make sure they don't have to do surgery if the calculi has been passed. That's the priority, is sifting, not giving water, even though you need to give them water. Okay, if you're doing a voiding cystogram, what are you going to do? Catch the urine in the Foley. Okay, say you put a Foley in and there's no urine. What are you going to do? Leave the Foley in and try again. You got the vagina, not the urethra. Okay, if someone's on TPN, what do you watch for? High glucose levels, correct. Okay, so you've got a baby in restraints. We're going to remove those one at a time for range of motion exercise, and we can't ever apply restraints continuously. Be aware that pre-op, what's going to happen to most patients' vitals? Blood pressure is going to rise. They're scared. What's the number one way to tell enteral tube feeding placement? X-ray. Yeah, you can also check pH, but number one is X-ray. This is interesting. Why shouldn't an anorexia patient be allowed to help with food preparation? Because it's fucked up and weird and makes them think they're better than everybody else. It reinforces perception of self-control. Okay, if you have Cushing's, what do you want to monitor? What lab? Blood glucose. Yeah, increased cortisol. What can urine-specific gravity be affected by? Dehydration. What is the best lab result for kidney function results? Creatinine. That's going to be your glomerular filtration. Creatinine is number one. Because again, urine-specific gravity can be affected by dehydration, and the BUN can be affected by glomerular filtration rate hypovolemia, and increased protein intake, and of course GI bleed. Okay, you have glaucoma. What do you use? Pilocarpine. Increases aqueous humor outflow in eyes. You're talking with someone who's paranoid. What do? You say, hi, this is my first name. Hi, this is your first name. Establish trust. Okay, so someone in their second trimester of pregnancy is having increased frequency and urination. What do you suspect? UTI, because when does frequency and increased urination occur? Third trimester. Okay, weird. Have no idea what Berger disease is, but don't smoke. Okay, you're 2 years old. How much of your speech is understandable? Half. 18 months old, so at a year and a half, what are we doing? 3-word sentences. And then 3 to 5 years old, what are we doing? We're counting 5 blocks and naming 4 colors. So in order, at 18 months, 3-word sentences. 2 years, half of your speech. 3 to 5 years, you're counting and naming colors. So if someone has cardiac dysrhythmia, what are they at risk for? They're at risk for injury related to syncope and confusion. Oh my God, save your pancreas. How do you do it? Don't smoke and you won't get cancer. Okay, the psychotic questions are psychotic. So remember, don't challenge delusion. So don't reorient. Don't say like, oh, you're at this place. You're safe here. Don't offer false reassurances. So don't say things like, oh, you'll feel better after you do this, because you don't know that. And then don't ask why. Do you really want to know why? But don't ask why. It's hard for psychotic patients to explain. It's hard for them to talk about their feelings. So just do things like, I'll sit with you. I'll leave this tray here. I'll be here if you need me. Okay, if you're pregnant, you have a lot of edema, what are you going to do? Shake your body, shake your body. You're going to get up every hour. The stockings aren't going to help as much with the edema. They'll help with varicose veins, but moving, straightening out the pelvis really helps with decreasing edema, especially in the feet. Legs up the wall is great too. Okay, signs of a superinfection. Ow, my mouth feels so sore. I think I had thrush. Thrush is the superinfection. Okay, someone has kidney stones. We already talked about this. What do you do? Strain that shit, may prevent surgery, save the healthcare machine some money. Oh my gosh. Okay. After you're done feeding an infant, what position do you never ever want to place them on? Their back. You can put them right side lying to increase digestion. They'll puke out the side of their mouth. Okay, disulfiram, that antabuse stuff. What is a side effect of it? If you take it with alcohol, what are you going to get? Besides death. Headache, vomiting, flushed. Okay, on to pharm. Here we go. You can do this. Nitrate, isoorbid. Treating for angina. Side effects. Orthostatic hypotension, expect dizzy. Sulfonamide, given for UTI. Think UTIs, what do you want to do with sulfonamide? Drink lots of water. It's a UTI. You want to avoid crystalluria. Do not take antacids. I don't know why. And it's also best on an empty stomach. Okay, you're taking guaifenesin, Robitussin. You have a dry cough, congested nasal passage. Avoid alcohol on everything. Increase your fluid intake because you have the dry cough. And then for anything, if the cough lasts longer than 1 week, consult the doctor while you're taking any sort of anticholinergic. Nystatin, your favorite, mycostatin. It's an antifungal. You use it on vaginas and in the mouth. Treat oral thrush. Phenazopridine, UTI analgesic. Phenazopridine. It's just the analgesic, remember? Take it for about 2 days and take it with food so you avoid gastric irritation. Phenazopridine for the UTIs may turn your urine orange or red for those 2 days you're taking it. Okay, you know this one. Methylprednisolone, 1, corticosteroid. Methylprednisolone, Solu-Medrol. How does it change your lab values? Increases sugar. It's a corticosteroid. What else do we know about steroids? What did they do to your bones? Make them weaker, so decrease calcium, and then also decrease potassium. Benztropine mesylate combined with carbidopa, levodopa, Sinemet. We take those for Parkinson's. And what are expected side effects? Dry mouth, dizzy. So just chew some gum and slowly get up. And I know you're thinking extrapyramidal. Good job. Lactulose. What do you use it for? Treat hepatic encephalopathy. Decrease blood ammonia. What are you expecting with the use of lactulose to treat hepatic encephalopathy? 2 to 3 soft stools a day. It's increasing peristalsis. Okay, ephedrine. It's a stimulant. Decreases blood pressure, increases breathing. Weird. Okay. Heparin. What test are you looking for? PTT. Partial thromboplastin time increase. Phenobarbital. We're taking phenobarbital for anxiety. Take it at the same time every day, preferably at night, because if you take phenobarbital, it's going to have sedation effects. So do it at night, which is weird that you're getting rid of your anxiety at night when you're sleeping anyways. I don't know. Sildenafil, your favorite, Viagra, using for ED. Closely monitor cimetidine. Any dynes, ranitidine, cimetidine, the H2 receptor blockers that decrease acid secretions, really closely monitor patients on that. So you can't be fat with GERD and take your Viagra pill because the H2 receptor blocker contraindicated. So for all antibiotics, we want to get a clean sample first, whether that is a sputum sample or a clean catch urine for UTIs, like pneumonia would be the sputum. Remember, just get the sample before you administer the antibiotics. Okay, 3 medications to control long-term seizures. Carbenzapine, phenobarbital, and Phenatin. I know we had phenobarbital for the anxiety disorder already, that we were taking at the same time every night because of the sedation, but we're also taking the phenobarbital for seizures. So carbenzapine, phenobarbital, and Phenatin. Okay, carbenzapine, what do we watch out for? Myelosuppression, blood dyscrasis. How would we know if there's any blood dyscrasis? Flu-like symptoms such as a sore throat. Phenatin, Dilatin is kind of funny. What you have to do with that is phenotone and brush or floss daily to prevent gingival hypoplasia, which is common with long-term use. Okay, you are experiencing a status epilepticus. You've been taking these long-term medications. They're probably not going to work. What's the medication you're most likely to receive if you're status epilepticus? Diazepam, Valium. What does ginger do? It's a blood thinner. It's an anticoagulant. Caution with use. All right, so we have 2 drugs together. We're treating psychosis with olanzapine and benzotropine. The olanzapine might give you some extrapyramidal symptoms. So we're going to take benzotropine, another anticholinergic, to treat those symptoms. Okay, when do we not want to induce vomiting? Five things. Children under 1. Petroleum distillates like charcoal lighter fluid, or when using corrosives like dishwashing detergent. Okay, we have this nitrates. They're going to vasodilate. And if you take a diuretic, what do we want to watch out for? Hypotension, right? Because we have less blood volume because of the diuretic, and then we're vasodilating, so we have less blood pressure, so hypotension. Okay, tell me about nitrosublingual tablets. Take at onset of angina, stop activity, 1 tab every 5 minutes, can take 3 doses, so 5, 10, 15 minutes. You have to replace them every 3 to 6 months, and you can expect relief in 5 minutes, right? You can take them every 5 minutes up to 3. What is the route for enoxaparin? Subcutaneous. All right, digoxin. What parameters do we have to watch? Lower than 60 beats per minute, higher than 110, or irregular heartbeat. We're going to hold the dose, call the provider. Digoxin toxicity risks. Hypokalemia. Digoxin toxicity signs and symptoms. Halos, visual disturbances, anorexia, abdominal pain, nausea, vomiting, bradycardia, AV, dissociation. Okay, when we're talking penicillins, ampicillin, anycillin, penicillins, ampicillin, what is the common side effect? Rash. Penicillins, watch out for that anaphylactic reaction. Okay, we're taking clonidine, catapress. Catapress, meow, asshole, it's not a vasopressor. It's actually an analgesic, antihypertensive, and it does the fucking opposite. It lowers your blood pressure. Okay, hydromorphone, you take it, you puke. Bleh. What medicine can you give to stop the puking? Ondansetron, antiemetic, Zofran. Common side effects of antineoplastics. Alopecia, nausea, vomiting, bone marrow depression. So if we have a thyroidectomy and we're taking hormone replacement, what are some side effects? Things associated to increasing metabolism, right? So tachycardia, chest pain, slight intolerance to heat. When do we want to tell our women and elderly to take calcium and vitamin D? Small doses throughout the day, about an hour after meals and at bedtime. This one's interesting. So we know that we can't take sildenafil with H2 receptor blockers, right? We have to watch that. Any dynes. But what is the H2 receptor blocker blocked by? Antacids. So you want to take your antacids after a meal, and then you can take your H2 at bedtime, perhaps. All right, we're going to ask you, what are the classic manifestations of nephrotic syndrome? Proteinuria, hypoalbuminemia, and edema. Okay, when we are having cerebral palsy, what is the classic positioning? Opistinoths. What would be decerabit? Arms out. Decorticate. It's the flexing posture. Severe cerebral cortex pressure. Signs and symptoms: increased ICP in an infant. A shrill cry would be an indicator. Kawasaki disease, signs and symptoms: hyperemia, red throat. It's also called musculoskeletal lymph node syndrome. Infants with tetralogy of Fallot, hypercyanotic. What do you do to treat them? Need a chest, 100% oxygen, morphine, IV fluids as prescribed. Okay, RSV, respiratory syncytial virus. Isolate the child, monitor high Fowler's. Neck slightly extended. Don't have anything flexed, right? Cool humidified air, contact precautions, wash hands. You don't need to wear a mask. It's not airborne. Weird, because it's, I know, respiratory. Okay, Hirschsprung's megacolon, foul ribbon-like stools. That's one you wanted to remember. Okay, how do you know if your hernia is strangulated? There will be vomiting and pain, and this irreducible mass. If you have hepatitis, what is your diet? Well balanced and decreased fats, right? Because liver, we're thinking about the LDLs and the HDLs that are all made there. So if you have TB, you're positive for it. What are you taking? Isonads for 9 months. If you have AIDS, you're taking it for 12 if it's latent. If it's an active infection, you're going to take daily for 2 months. Isoniazid, rifampin, pyrazinamide, and then twice a week for 4 months, Isoniazid and rifampin. When you're taking Isoniazid, what do you have to check before? Liver enzymes, right? Because they might increase liver enzyme function tests and hepatitis. And remember, with Isoniazid, what's your urine going to be? Orange and red. Every infant is screened for PKU. If someone has pyloric symptoms, pyloric stenosis, sign and symptom is projectile vomit. If you're lactose intolerant, what do you want to supplement? Vitamin D and calcium. What is the level for digoxin? 0.5 to 2. What is the limit for lithium? 0.5 to 1 to 2. If someone has lithium toxicity, what are we going to see? Mental confusion, coarse hand tremors, muscle hyperirritability, incoordination. All right, sorry, this is not helpful anymore. Allen's test. Before a radial artery puncture, you're doing it to see how the ulnar artery is. It's positive that the color doesn't come back. Don't draw. Ketoacidosis, what kind of breathing? Kussmaul's. Right. A sign and system of respiratory alkalosis is hypokalemia. Alkalosis, kalemia. I don't know. Hypokalemia. I don't know. Sorry.